just want to dispel a few myths about statins. Hi, I'm Dr. Toby. What I want to talk about today is going to be a little bit controversial for some, and I appreciate that. But I would like to look at the science behind cholesterol and the treatment for cholesterol. We know that the evidence is great that if you leave somebody with LDL cholesterol, the bad cholesterol, what will happen is plaques start to build up in the arteries. These plaques narrow the arteries and could potentially lead to things like early heart disease or strokes in the future and cardiovascular disease. What we say now is the lower the LDL cholesterol, the better. Now, how do we lower LDL cholesterol? Widely known one way is to reduce the cholesterol with diet. So that's the saturated fat, things like butter, cheese, red meat, and increasing the soluble fiber in the diet as well will help reduce the cholesterol, like in some studies up to 30%. Exercise can help a little bit as well. But for many people, they do all these things and the cholesterol doesn't come down to less than 100. And so in these people, we need to give medication to treat cholesterol. Now, one of the most effective methods to reduce cholesterol is by giving people a medication called a statin. People tend to associate statins with things like dementia, terrible joint pains, liver disease. The first thing is statins do not cause dementia. There's very good evidence to suggest that this is the case. They may actually help reduce the risk of dementia, particularly vascular dementia. The second thing is statins do reduce your risk of cardiovascular mortality, in some studies up to 25 to 30%. They will reduce your risk of heart attack or stroke, particularly in the right patients who we select them for. The third thing is statins reduce your risk of dying of anything, of what we call all-cause mortality, particularly in older populations. The fourth thing is statins do not cause liver failure. Statins can cause minor increases in your liver enzymes, but the risk of liver failure with statins is very rare, so less than 1 in a million. I would encourage you to be more open-minded about cardiovascular disease and its treatment. Obviously, the first thing to do is improve your diet, but if that's not helping, come down, let's have a discussion around it and come up with a specific treatment plan for you.